Welcome everybody to the first congressional briefing of the Physical Activity Alliance. We are delighted that you're here with us today to talk about the important role of physical activity. If you have any questions during the briefing, please put them in the Q&A section and we will get to the questions at the end of the briefing. Also, we are recording this webinar to place it on our website later at a future date. My name is Monty Ward and I represent the American College of Sports Medicine. I am also the president of the Physical Activity Alliance. In 2019, it was recognized by several leading organizations in the physical activity field that we needed one voice to advocate on the importance of physical activity. Through those discussions, the Physical Activity Alliance was created by the merger, and next slide there please, by the merger of the National Physical Activity Society, the National Physical Activity Plan, and the National Coalition for Promoting Physical Activity. After that merger, 12 other organizations joined the Alliance. You can see the list of those organizations there on the screen. American College of Lifestyle Medicine, the American College of Sports Medicine, American Council on Exercise, the American Heart Association, American Institute for Cancer Research, American Medical Society for Sports Medicine, American Physical Therapy Association, International Health Racquet and Sports Club Association, MyZone, National Athletic Trainers Association, National Youth Sports Health and Safety Institute, and NERSA, Leaders in Collegiate Recreation. All great organizations dedicated to advocating for physical activity. At the PA, the mission of the Physical Activity Alliance is to lead efforts to create, support, and advocate policy and system changes that enable all Americans to enjoy physically active lives. We envision an active and healthy nation where the opportunity for physical activity is easily available in the daily lives of all Americans. The Alliance works closely with Congress on several different issues, and we are pleased today to hear from two champions of physical activity, Congressman Ron Kind and Congressman Brian Fitzpatrick.
Hi, I'm Congressman Ron Kind, and I'd like to thank the Physical Activity Alliance for inviting me to participate in your congressional briefing. Being physically active is one of the most important lifestyle behaviors we can engage in to maintain our physical and mental health. It's been said that one of the best antidepressants ever invented is good old-fashioned sweat. Physical activity can also help prevent and treat some of the most common and deadly diseases in our society, including cardiovascular disease and cancer. Unfortunately, the pandemic has made it even more difficult for many Americans to be physically active. Even during a global pandemic, though, it's critical that we work to encourage physical activity as we recover from the COVID virus. Today, we're excited to announce that the Congressional Fitness Caucus will come under a new name, the Congressional Physical Activity Caucus. I've been a co-chair of this bipartisan caucus for many years, and I look forward to working with my colleagues to continue to raise awareness about the connections between physical activity and our health.
Hey everybody, Congressman Brian Fitzpatrick here, and thank you to the Physical Activity Alliance for allowing me the opportunity to participate in your congressional briefing. The Physical Activity Alliance is our nation's broadest coalition dedicated to promoting physical activity for health, and I proudly stand beside you in our joint mission to encourage and raise awareness of the importance of physical activity. Being physically active is one of the most important lifestyle behaviors we can engage in to maintain both our physical and our mental health. Not to mention, it produces innumerable benefits that directly contribute to a healthy, happy, and positive life. Regular physical activity is vital in maintaining and improving our health, and it can also play an integral role in treating and preventing life-threatening diseases. Now more than ever, physical activity is especially essential for our health and well-being as we continue to navigate through the COVID-19 pandemic, which is why today we are excited to announce the transition of the Congressional Fitness Caucus to the Congressional Physical Activity Caucus. And as the co-chair of this bipartisan caucus, I am thrilled and looking forward to working with my colleagues as we continue our efforts to promote, educate, inform, and inspire others to engage in physical activity to bring about positive changes and improvements in our physical and our mental health.
We appreciate Congressman Kind and Congressman Fitzpatrick providing us with some remarks today. And as they mentioned, the Congressional Fitness Caucus is transitioning to the Congressional Physical Activity Caucus. We are very excited about the name change and the focus on overall physical activity and health. The Congressional Physical Activity Caucus website will be hosted in the coming days on the Alliance website at paamovewithus.org, and we're looking forward to all the activities that are planned for the caucus. Now on to our policy agenda. We are often asked, why physical activity? Being physically active is one of the most important lifestyle behaviors people can engage in to maintain physical health, mental health, and well-being. In the U.S., only 26% of men, 19% of women, and 20% of adolescents report sufficient activity to meet the relevant aerobic and muscle-strengthening physical activity guidelines. These numbers have likely worsened during the COVID-19 pandemic. In a recent American Psychological Society study, 42% of Americans reported undesired pandemic weight gain at a median of 15 pounds. Regular physical activity is both health promoting and important for treatment and prevention of diseases such as cardiovascular disease and cancer. These diseases are the leading causes of death in the U.S. Studies show that physical activity is associated with strong immune response, risk reduction from community-acquired infectious disease and mortality, and increased vaccine potency. Physical activity also contributes to social connectedness, quality of life, and environmental sustainability. Low physical activity and fitness pose immediate and long-term threats to our nation's safety and security. Currently, 71% of Americans ages 17 to 24 fail to meet core eligibility requirements for entrance into the military, creating a serious recruiting deficit. Among those who do meet basic requirements for service, injuries associated with low fitness levels cost the Department of Defense hundreds of millions of dollars and have been identified as the most significant medical impediment to military readiness. We have with us today 3 of our members to discuss policies that will help get Americans moving to combat against some of these alarming statistics. We have Amy Callender, Director of Government Affairs of the National Athletic Trainers Association, Lori Witzel, Vice President of Policy Research and Translation at the American Heart Association, and Brian Williams, Director of Policy and Advocacy at the American Medical Society for Sports Medicine. Amy, the floor is yours.
Good afternoon, everybody. I'm Amy Callender, Director of Government Affairs for the National Athletic Trainers Association. Thrilled to be with you this afternoon. And I wanted to address just some key points and priorities that the Physical Activity Alliance is looking at across the federal landscape. Excuse me. So we believe that physical activity is integral to population health and well-being, educational achievement, effective healthcare delivery, emergency preparedness, and military readiness, much of which Monty just mentioned. We will continue to pursue a physical activity approach in all policies at the federal level. So what does that mean? Where federal government is addressing nutrition, obesity, healthy living, and or chronic disease, physical activity should be given consideration. With that, we'd like to address the a renewed commitment by this administration and Congress to fund and prioritize the President's Council on Sports, Fitness, and Nutrition. We've enjoyed a long working relationship with this organization and hope to continue it in the future. Obviously, we believe that physical activity is key to public health, and incorporating physical activity and other lifestyle medicine services into the upgrade of a public health infrastructure, surveillance, and data modernization efforts is key to the success and health of our nation. We also need more physical activity research. We need to invest in physical activity research across the federal government, and that includes agencies that are pretty typical, NIH, DOD, but also include transportation, education, and agriculture, and HHS and CDC, and any other relevant agencies that are conducting research that addresses the need for long-term health of our nation.
So thanks, Amy. I'll take it from here. Good afternoon, everyone. It's great to be with you. I'm Lori Witzel, Vice President of Policy Research for the American Heart Association and Senior Advisor to the Physical Activity Alliance. It's really exciting to be with you today to talk about our policy priorities and the work that we're doing to promote physical activity across the population. I'd like to talk to you about what I would really like to focus on in my presentation is the work that we're doing in the healthcare sector, a campaign that we're calling It's Time to Move, and it's really an historic campaign that we're leading with our organizational leadership partners to address and integrate physical activity into the American healthcare system. We'll go to the next slide. So Monty already summarized and really articulated in a great way the evidence behind this work. In the 2018 Physical Activity Guidelines for Americans, not only did the guidelines give the recommendations for population physical activity, talked about, and focused on the extraordinary health benefits that come with a physically active lifestyle, but for the first time highlighted the important role of healthcare professionals in assessing and prescribing physical activity. And so this is why this is such an important focus for our alliance. As Monty said, we can address chronic disease management and treatment, but as we come out of the COVID pandemic, addressing the important issues of mental health and well-being, social isolation, and reducing the risk of infectious disease, increasing immunity, physical activity and physical fitness play an important role in each of those, and that's why it's so critical to integrate it into our healthcare delivery. So we can go to the next slide. And the reality is that millions of Americans each year, as they go into their clinical visits, they don't really get this assessment. They don't get physical activity assessment or counseling, prescription or referral when they're talking to their healthcare professional. It's one of the only vital signs that we identify at the American Heart Association as a key measure for cardiovascular health. It's one of those key measures that is not assessed regularly during the clinical encounter. And so we really want to empower healthcare providers and patients so that this becomes a seamless integration into patient care plans. So, and Amy referred to the ongoing healthcare data modernization and surveillance efforts that are happening at CDC as a result of COVID. One of the important data superhighways into the surveillance upgrade is the electronic health record. And so the timing couldn't be more important to integrate physical activity into the electronic health record to make sure that not only is it there for patient care and patient care plans, but also to optimize our surveillance efforts in the United States around population physical activity. So Anna, if you could go to the next slide. So one of the things that we're working on, we want to engage with the HL7 process to develop a standardized measure for physical activity and integrate it into the electronic health records to optimize delivery of care. So this is an initiative that we have developed a roadmap over the last 6 months on how to engage in this process. And then we hope to begin this work later in 2021. But this is going to be fundamental to reimbursement and payment and integrating into standard of care. So the first step is to have that standardized measure in the EHR. And so the next slide, Anna, really talks about what we hope Congress can do to support this work. We hope that Congress will be supporting physical activity assessment, prescription, and referral in healthcare wherever possible, including mandating that the Centers for Medicare and Medicaid Services support coverage and payment determinations by healthcare providers and health and fitness professionals for physical activity prescription and referral. And also, we hope that physical activity can be integrated into the remote patient monitoring and telehealth expansion that's happening as a result of coverage right now, as a result of COVID right now. So this is another really important piece of work, and we hope will be a commitment of Congress as well. And I think the final slide, Anna, really talks about some of the other work we're doing across our action plan in this space. As I already mentioned, the telehealth integration, working with the Office of the National Coordinator for Health Information Technology on remote patient monitoring, including physical activity, working with NCQA and NQF to address quality and performance measures, and finally, with the American Medical Association on CPT codes. So we're really excited for this work that we're doing. We hope Congress will be an important partner with us in addressing physical activity integration across healthcare and patient care, and we look forward to working with you in the future. So I'm going to turn over to Brian right now to take us through his slides.
Hey everybody, I'm Brian Williams. I'm the Director of Policy and Advocacy at the American Medical Association. I'm sorry, the American Medical Society for Sports Medicine. I almost changed my job there. Hey, we appreciate you being with us this afternoon. We know what it's like. I mean, we've all been in this situation for the last year or so now. All of us know what Zoom fatigue is, and for you to spend a little bit of time with us this afternoon is really appreciative. I hope that we've been able to convey to you the importance of the new Physical Activity Alliance and the importance that we see not only here in Washington, D.C., but throughout America on the importance to highlight physical activity. The presentations that you've heard preceding mine and the ones that you'll hear after mine, I think ought to convey to you just the sense of this unity and this coalition that we hope to bring to the debate. So those are points that I hope that you'll take away. But what we really need from you guys, especially those of you who are Hill staffers on the House or Senate side, we really need you to be ambassadors for us on Capitol Hill, ambassadors for physical activity. And as we switch slides to the next slide, this is the checklist portion let's pull up that first bullet point. There's several legislative action items that we'd like for you to kind of take note of and have kind of on your front burner, if you will, as things come up. The first one is what has always been called the PAR Act, or the Physical Activity Recommendations Act. That's what we used to call it. I guess it just got a new name as it was reintroduced the last week or two. We've renamed it the Promoting Physical Activity for Americans Act. But we would like you to look at that bill and ask your boss to co-sponsor it. That bill would require HHS to publish physical activity recommendations every 10 years with specific recommendations for subgroups of Americans like children and people with disabilities and senior citizens. And the reason that's important is because it sets a standard, right? It sets a standard for what is a proper amount of physical activity for these groups of Americans, and gives and informs and educates really Americans on what levels of physical activity they should be receiving. And we all know that as you inform and give Americans the information that they need, that it empowers them, right? It empowers them to go out and make decisions in terms of their own physical activity levels. The other nice thing about this bill is it requires just sort of every 10 years, the recommendations are published, but in between that, there are some mid-cycle reports that kind of describe best practices and some other data to help promote physical activity. The next point is so what we've done here is we've kind of set the standard, right? With the physical activity standards, we now know what the standard is. So the next point would be we need to provide the means in order to do this. And so take a look at the FIT Act. That's the Personal Health Investment Today Act. And there's bill numbers and sponsors listed there on the slide. But what the FIT Act does is it expands the use of health savings accounts and flexible spending accounts to purchase things like health club memberships and the costs of participating in fitness programs and other expenses that are directly related to healthy lifestyles. You know, HSAs, health savings accounts, are extremely popular. Back as of December 31st of last year, there were more than 30 million HSAs worth about $82 billion. And the whole point behind an HSA is to give people kind of control over their healthcare dollars so that they can choose how to spend it. And physical activity dovetails right into that argument. Physical activity is a very personal decision, right? I'm the one that decides whether I'm going to go out and walk or ride my bike and so forth. And a health savings account, which empowers Americans to make their own decisions as far as health expenditures go. We ought to expand those to include some of those expenditures that would help Americans be more physically active. Okay, right now health savings accounts are almost entirely used to treat disease, but what this would do is to allow us to use HSAs to not only treat disease, but to prevent disease from happening in the first place. And I think that's fiscally responsible and a way to sort of liberate health savings accounts to be able to be used in this way. So on the next point that will come up here in a second, so what we've done is we've set the standard and we've provided the means, right? We need your help to do that. And the final piece of legislation to take a look at is the GYMS Act, the Gym Mitigation and Survival Act, HR 1890. You all, I'm sure, have seen the news reports. The fitness industry has just almost been entirely decimated because of the shutdowns that have happened in all the states. And this bill, the GYMS Act, would provide a $30 billion fund to kind of help the fitness industry get back up on their feet. I literally have a neighbor that lives down the street from me. He's a fitness instructor at our local gym. I'm in a suburb of Washington, D.C. right now, out in Maryland, and all of our gyms were shut down. He's been out of work for a year. They literally have had to, they're selling their house and are going to move to Texas in the next couple of weeks so that he can get a job in Texas where the gyms apparently are open down there. But this has affected a lot of people. The fitness industry has really taken it on the chin. The Paycheck Protection Program has been helpful, as I understand it, but gyms aren't all in. They're not entirely dependent on paychecks and workforce. A lot of gyms, they have, they're limited now in their capacity, how many customers they can have at any given time, and they have sort of unique challenges surrounding sanitation, and they just have a lot of extraordinary challenges from the pandemic. So we would ask you to take a look at the GYMS Act and get maybe put together a memo for your boss on co-sponsoring that. In fact, on all of these pieces of legislation, if you have any questions about any of these, please reach out to me through the Physical Activity Alliance, or Laurie, or Monty, or Amy, or any one of us, and we'd be happy to answer your questions on any of these pieces of legislation. The bottom line would be, though, we would ask you to co-sponsor them and help us move those this Congress, see if we can see all three of those pieces of legislation pass this Congress. The next slide are some legislative action items that aren't necessarily front burner, but we would love you to keep an eye out. They're going to come up later this year, certainly sometime this Congress. The first one has to do with transportation reauthorization. That may come up sooner than we think. Kind of dovetailing on what Amy said, and Laurie and others, Monty, just what we need to do is to build a transportation system that incorporates active use, right? So it seems like a no-brainer, but if we're going to build a road, as long as Congress is funding, transportation for automobiles and a road, for just a little bit of extra, we can add a bike lane, sidewalks and other things, so that people can decide to be they can actively move and instead of just being trapped in a car. And we've seen there's a lot of data on this in communities that have bike lanes and sidewalks and other modes of transportation besides automobiles. There's higher satisfaction in the community, higher physical activity rates, and so forth. So as transportation reauthorization comes up, please look at that, especially the Transportation Alternatives Program, the TAP program. That's actually the largest source of funding for a lot of the biking and walking programs that are popular in your districts and in your states. The Safe Routes to School program, the Rails to Trails, where they're converting old, unused railroad lines into trails. I have one of those in my community. An old rail line that's no longer used anymore makes a terrific biking and walking trail, and are very popular with people. So the next item is kind of dovetailing again what Laurie was talking about, the public health infrastructure surveillance and data modernization. A lot of that is CDC funding. So as appropriations come up, please take a look at the Division of Nutrition, Physical Activity, and Obesity. We're asking for $125 million this year, and it's not appropriation season quite yet, but when it is, we're going to come back to you and ask you specifically to look at that funding level. Within that is the Active People Healthy Nation program, and they have, if you haven't looked at that, take a look at their website. They have an aggressive goal of getting 27 million people active by the year 2027. And then overall, just sort of the overall chronic disease prevention budget. We've signed on to a pretty aggressive effort to increase that to $3.75 billion over 3 years. Okay, so please take a look at that. This is a critical time for public health infrastructure, and we need your help on that as well. The next point, Laura's kind of already covered this, but right now for physicians, I represent sports medicine physicians, but for a physician to consult on physical activity and prescribe physical activity, it's very difficult to find reimbursement codes for that over at CMS, and we'd love your help and assistance in working with CMS to make sure that we can use the CMS, the Medicare codes in order to prescribe physical activity and promote physical activity in the doctor's office, right? We know that a lot of people will, they listen to the public service ads, they listen to the athletes on television, they have all these different things telling them to be physically active, but a lot of them simply will not do it until their doctor tells them to do it, right? And once the doctor says it, most people trust the doctor and they'll go out and be physically active. But what we need to do is facilitate that by making it reimbursable so the doctor can be reimbursed for his time in that. And then the last point I want to make before closing is just sort of that general point. A lot of this we've already talked about, but just keep an eye out for opportunities to promote physical activity. Military readiness, for instance, and retention in the military. Physical activity is an integral component to military readiness. So if you're on armed services, we would love to work with you on that issue. And opportunities in the community and with youth, particularly to be physically active. Again, thank you for all you're doing. Appreciate your time this afternoon, and please get in contact with us if we can answer any of your questions. And I'll pass it off on to Mike.
Actually, I'm going to jump in here real quick, Brian. Thank you. Appreciate those presentations, Amy, Lori, and Brian, on our the policy agenda for the Physical Activity Alliance. A quick reminder to you all that if you have questions, please put them in the Q&A section, and we'll get to those questions as we get to the end of our presentations here today. But now I'd like to take some time to turn some time over to Mike Levique, who is CEO of MyZone and a board member of PEA, to discuss the Congressional Physical Activity Challenge. Mike?
Okay, thanks, Monty. And as Monty mentioned, I'm the CEO of America for MyZone, the world's leading wearable technology for the health club market. At the beginning of the briefing, Representatives Kind and Fitzgerald talked about the many benefits of physical activity, and now it's time for us to lead by example with the Congressional Physical Activity Challenge. And now, to get us all in the mood for the challenge, we'll play this motivational video.
Into the green zone now, girls. Here we go. Let's start building. Come on. Leg drive and pull. Another day, another mile. You've been gone a good long while. Another hill, another climb. 10 seconds, double time. Run.
Let's raise the heart rate.
Still have to go. Where it ends, nobody knows. In the wind blows. Quick. 5, 4, 3, 2. Time. Breathe. Wrapped up. That's a wrap today. Done.
Okay, next slide here. The worldwide launch of the MZ Switch was yesterday, and we're honored to have this patent-pending technology as the official collection device of the 2021 Congressional Physical Activity Challenge. Next slide. The key feature of the MZ Switch is that it measures intensity during physical activity and rewards MyZone effort points for all physical activity above 50% of the maximum heart rate of the user as per the World Health Organization and CDC guidelines for physical activity. Next slide. The MZ Switch is the first device in the world that can be worn as a heart rate monitor on your wrist, arm, or chest. Of course, the chest is the most accurate placement with 99.4% accuracy to an ECG, but for repeatable, predictable movement, non-gripping activities, the wrist or arm placement may be more comfortable. Next slide. Now, the ethos, why did we develop this product? Well, we developed a product to make physical activity even more fun, accessible, and inclusive. Inclusivity in fitness is more important now than ever. Second reason is to empower communities and drive even more social connection. We find when people work out together, when people are connected socially on our mobile application, they work out more. We also developed it to combine self-care and comfort with a chest, arm, and wrist strap to suit any of our users, to unlock physical activity for people to move in their own way in the gym or outdoors or in the water. They can actually swim with this device. And we wanted to make sure to paint a better picture of community activity with availability of more data inside a facility or outside the facility. So what are the details and timings of the challenge? All members of Congress and congressional staff are not only eligible, but encouraged to join the Physical Activity Challenge. Each participant will be given an MZ switch at no charge to them to use during the Physical Activity Challenge. Offices will submit their participant list to the email address below by April 9th to make sure that we can get all the devices to Washington, D.C. by the 20th to pass out to each office to make sure that all the devices are registered and ready to go on the 26th. All of this information will be in a flyer that we'll be passing out to you right after this conference. Challenge starts on April 26th. You can train anywhere. You don't have to be in a gym. You can be running, cycling, do any type of physical activity, and you can upload your workout to the mobile application and view your leaderboards on the MyZone app. Challenge ends on May 26th, and then at which time MyZone and the PAA will collect all devices from staff on June 1st. Due to the Congressional Ethics Office rules, we're not allowed to leave you with the devices. Now, the winners will be awarded based on the following: top individual point earner, top office point earner, and this is my favorite, the most office staff participants to reach the World Health Organization guidelines for physical activity. The device actually tracks your effort during physical activity, and 1,300 MyZone effort points translates to the monthly allowance for the World Health Organization guidelines for physical activity. Next slide. So look out for the challenge flyer that will be circulating to each of your offices, and we hope that each member of Congress and all of their staff will join us in this exciting challenge using the latest MyZone technology.
Thank you, Mike. Appreciate that. The Congressional Physical Activity Challenge is going to be a great way for members of Congress, their staff, to enjoy the benefits of physical activity, all with a little friendly competition. Always a good thing. So we're looking forward to that. So we have a few questions we want to address here today before we get going too far down the road here. And if possible, maybe like to have maybe all the panelists come on, bring their cameras up, if that works, if we can do that. And then the first question I want to ask is, can you give us an idea about how the pandemic has affected physical activity? And so any of you panelists feel really like you really want to answer this question?
Hey, Monty, it's Laura. I can try to answer it to some degree. You know, we're waiting to get more surveillance data from CDC. We understand that might be forthcoming. I think it's had variable impact across the U.S. population. Kids, we're hearing that kids might have found more time for free play, but certainly they struggled in terms of access to youth sports and physical education programs in schools. Although schools did their best to adapt to the environment and to the online virtual delivery, it was still, you know, quite challenging. And for adults, you know, we think that it may have had a more negative impact, increasing physical inactivity. But we're going to have to, all that's going to have to be verified with forthcoming surveillance. And just to say that kind of reiterates the importance of making sure that physical activity is integrated into the national surveillance sets and that we can improve on that so that we really understand the impact on population health as a result of the pandemic, but also going forward from COVID.
Appreciate that. Thank you, Lori. Others? Okay. There's also a question about whether there'll be summaries of the legislation that we talked about today. We will send that out afterwards. As those that are participating in the briefing today, we'll send those out to you, so you'll have some one-pagers on the bills and also a summary of the PAA agenda as well. So we'll send those to you. A lot of documents to look through, but it's good information to be able to kind of talk about the legislation that we're talking about today. All right. Got a question here about their activity deserts in the low-income urban areas. Will active infrastructure include development of parks, trails, fields, courts in the urban areas?
Monty, I can take that if it's okay. The big answer to that is yes, and we are working really hard. There are a number of us working together as we address federal transportation reauthorization to make sure that active transportation is being funded at the local level, and that includes recreation and green spaces. We're hoping to make that a focus of our late April, early May webinar in partnership with Active People, Healthy Nation. And so much more to come on that, and with more specific information on legislation and legislative asks.
Thank you, Laura. Appreciate that. One other question, I'm just trying to look through the questions here. Mike, could you share the email address again that people need to send their list to, whether there'd be their office list or their individually if they want to send it, to you? What was that email address again?
Yeah, and we will be sending the flyer out as well that will have all of this information to each office, just to make sure that you all can sign up. But it's congressionalchallenge@myzone.org, and we look forward to getting, I guess that would be 535 emails with names and participants in the challenge. So we really encourage every office to sign up.
Appreciate that. Okay. One other question that came up is how do we hope to work with the new renamed caucus? It's a great opportunity for the caucus to get a new name, a new focus on physical activity. How will the PAA and other organizations be able to work with the caucus to be able to promote physical activity and health?
Monty, you and I could probably both answer this one, but it's just so exciting that we have this opportunity to work with a new renamed, rebranded caucus. We truly hope that we can build membership in the caucus, that we can do, we can work together for events that promote physical activity on the Hill. We hope that members of the caucus will be co-sponsors for the key physical activity legislation that we highlighted today, but also going forward. And most importantly, that these members of Congress will be personal champions in their own community for physical activity and fitness. It's just, as policy leaders, it's just so important. Their voice is so important in being an advocate.
Yeah, I think that the caucus is going to be a great, an active caucus. Let me put it that way. For this physical activity caucus, I think they're going to be able to be very active in supporting some of the legislation we're talking about by sending dear colleagues and pushing for co-sponsors, things like that. And as you mentioned, some of the briefings and things like this, I think they'll be very active in the things that they're trying to advocate for up on Capitol Hill in support of physical activity. There is a question about who is the point of contact to join the caucus. In Congressman Kine's office, that would be Jill O'Brien. And in Congressman Fitzpatrick's office, that would be Joe Knowles. They are the two staffers who are handling the issues for the congressman. And so you can contact them to be able to join the caucus. And that's, we haven't really mentioned that too much here, but we'd love to have everybody join the caucus for those members of Congress to be able to be an active member of that caucus. So please contact them to be able to join the caucus. Let's see here. There is a question about funding for states to be able to support physical activity in their states. CDC has some funding available as well, but it's not only going so far. And the question is about what the $125 million at CDC is for to fund those states. And Lori, do you want to take that one, or Brian, do you want to take that one as well, as far as what that funding for is at CDC?
Yeah, I can start, and then Lori can correct me when I say it wrong. But right now, the CDC is only funding 16 states for the physical activity promotion efforts, and the Division of Nutrition and Physical Activity, if we could bump that up to 125 million, like I mentioned before, then I think that would allow CDC to expand that support to all of your states, all of your districts and states. So all 50 states would receive funding. Is that right, Laurie?
That's exactly right, Brian. I mean, there's a 50-state strategy that I think we need to promote through the chronic disease funding at CDC. And so, of course, the Division of Nutrition, Physical Activity, and Obesity, we want their funding to be able to get to all 50 states. And then just overall, the chronic disease budget at CDC, we hope that will be a key strategy that in all the funding streams that are going out from the agency across the United States, that we can get that to all 50 states.
Fantastic.
You know, and that ties in, just to quickly say, I mean, it's so critical right now as we know the impact of COVID, not just, you know, the infectious disease impact, but really the impact that it's had on the risk factors for chronic disease, diabetes, obesity, physical inactivity, healthy food access. You know, we have to address those risk factors. COVID has underscored that. And so this funding to CDC couldn't be more critical right now.
Thank you, Laurie. Got a good question about how do we see some of these policies we're talking about, they're all at that federal level. The question is about how do we see this working down to the state and local level? A lot of this legislation we're talking about is all at the federal level, but how do we see that working down to the state and local level?
It's a great question, Monty. And I think, we just talked about CDC funding getting down to that level, but as Bill asked, the transportation reauthorization, that's one thing that we want to focus on in our work, that federal money gets down into communities that have historically been under-resourced to build infrastructure for bike and pedestrian infrastructure, for green spaces, recreational spaces. It has to get to those communities. We've got to meet people where they are and get to populations that haven't had these investments in the past or have had underinvestment. So we're going to be trying to work through through organizations that are in the Alliance that have that infrastructure from federal, state, and local all the way across. We're going to work through our organizational members to try to make sure that reach goes from federal to local.
Brian, you mentioned the FIT Act. I mean, how would that get down to the state and local level?
Yeah, so I kind of alluded to it, but the FIT Act really does, it gets to even below that, gets to the personal level, right? So the FIT Act utilizes health savings accounts and flexible spending accounts, which are accounts that individuals and families own. You put away pre-tax dollars into a health savings account, and that is your bank account, right? Right now, it's really restricted on what you can use that money for. Most of it, like I mentioned, is on treating diseases. So if you go to the doctor's office or if you go to the dentist and get a cavity filled, you can pay for it out of a health savings account. But the FIT Act would expand that, right, and allow individuals to use their own money again to purchase or to offset expenses, let's say, for things that are related to healthy lifestyles, like a gym membership or equipment, physical activity equipment, like an exercise bike or something like that. That not only kind of liberates people to use their own money to prevent disease rather than just treat disease, it also kind of relies on that personal responsibility issue that you hear sometimes. Our group, the Physical Activity Alliance, we've been around. We just formed this year, but all of us are old enough to have heard the argument. Physical activity is about personal responsibility. Well, if you believe that, then we ought to co-sponsor the FIT Act and allow people, liberate people, so that they can use their health savings accounts to be personally responsible. By joining a gym or purchasing physical activity equipment. And again, this goes without saying, if you have any more questions about the FIT Act or any of this, just reach out to us, and we would love to sit down and walk you through it and kind of explain in more detail why it makes sense.
Thanks, Brian. Appreciate that. Amy, I've got a question for you about the President's Council. You mentioned that it'd be good to have them fully funded and functioning within the HHS. What is the purpose of the President's Council, or what's their real intent as far as the President's Council goes?
Somebody was bound to start talking without unmuting, right? It had to be me. So the President's Council is a group that is created within the Department of HHS, Health and Human Services, and their Office of Disease Prevention and Health Promotion. And they were created as a federal advisory committee to promote healthy nutrition and activity for Americans of all ages, abilities, and backgrounds. So regardless of where you live in America, they believe everybody should have access to healthy food and nutrition and physical activity. Just recently, in the last couple of years, they created the National Youth Sports Strategy and have created a group of advocates through there that are working on all the tenets of that. So to help make sport access more readily available to Americans, regardless of any barriers that they might have to participation in sport. So we'd really like to see those efforts continued as well, since they've just kind of gotten it off the ground and have created a great working group and a great strategy, and we'd love to see that continue as well.
Appreciate that. Okay, I think we're getting close to the end of the questions here. So, I mean, panelists, I'm going to give you one last shot here for anything you'd like to add, subtract, or to say about your different areas. And Mike, in some of these questions, I think we're getting really a lot of people are very interested in participating in the challenge. So I think we're looking forward to that. And please make sure they look out for that flyer that'll be coming soon after this briefing for more information. But any other last words here from the panelists?
Hey, Monty, just one thing. Regarding the challenge, there's no cost to join the challenge. It is open to all members of Congress and their staff. Unfortunately, it's not available to family members. It's just available to the members of Congress and their staff, but there will be no charge. We'll supply you with the device, and it's a really fun and motivating way to track your physical activity for the month. And we look forward to you all joining.
Thanks, Mike.
Mike, there was a question about district office staff. I'm just wondering about the logistics there, because we're going to be distributing these in Washington, D.C., as you said, on the 20th. It might be hard to get it to district staff across the country. That might be the barrier there, unfortunately.
Yeah, okay, so let's talk about that, and we'll send out some information on that after this call. And when we do send out the one-page flyer, we'll include information on that.
Sounds great.
Great. All right, Lori, Amy, Brian, anything else? Final chance?
I'll just repeat, we need your help, especially those of you that are on the Hill. We need you to be ambassadors for physical activity up on the Hill. So help us out, get involved, check out our website, reach out to us. We'd again love to sit down and go over this with you. Physical activity really is, it's not the panacea, but it's really close to it. It helps reduce cardiovascular disease, cancer, diabetes, all the big ticket items that are really killing us as far as the leading causes of death go, and killing us as far as the budget goes, right? But with a little dose of physical activity, and we need your help to do that, it will go a long way. And thank you again for your help.
Okay, Ayanna, if we go to that next slide, just a reminder about what our Physical Activity Alliance asks are for this call. And as we've gone through these, please make sure you co-sponsor the Promoting Physical Activity for Americans Act, HR 2094. Please co-sponsor the S844, the FIT Act, and then co-sponsor HR 890, the GYMS Act, and lastly, join the Congressional Physical Activity Caucus. We'd love to have you be a part of that, because it'll be something that we can work with you on getting people more physically active. And then if you're an organization out there, we've been kind of focused mainly on congressional staff and congressional members here, but if you are an organization that would like to get involved in physical activity, please contact us at the Physical Activity Alliance. You can see where to contact us there, the email address, on Twitter as well. But we'd love to be able to have you come participate with us to be able to kind of move the needle when it comes to getting people more physically active. Thank you all for joining us today, and we look forward to having you join our next briefing.